Thank you, Rebecca and the APDA. I'm delighted to be here today to talk about the utilization of rehabilitation services across diverse populations. To begin, I'd like to acknowledge the APDA for their funding for this grant. This grant was held while I was at Shirley Ryan AbilityLab and Northwestern University. And of course, with much research and care, I'd like to acknowledge my colleagues and team who helped with this research because, as we all know, it takes a village. We already heard a little bit about Parkinson's disease and its frequency and its impact, including both motor and important non-motor symptoms that can affect quality of life, day-to-day functioning, and outcomes. And for this project, I'd like to focus specifically on rehabilitation therapies. Many treatments include medications and surgery for appropriate candidates and a growing interest in the role of exercise. But today, the focus will be on rehabilitation therapies and their ability to positively impact symptoms, day-to-day function, and quality of life. They can help with motor and non-motor symptoms and reduce Parkinson's related complications such as falls, fractures, aspiration pneumonia, and others, which are incredibly important for affecting people's quality of life and their medical health. Most commonly, when we think about rehabilitation therapies, people may be aware of physical therapy, where physical therapists may work on motor function, exercise, and much, much more. But also occupational therapy, where occupational therapists will work on day-to-day functioning, everyday tasks, hobbies, work, driving, cognition, upper extremity function, as well as many more other items. And speech-language pathology, where speech-language pathologists will work on speech production, volume, expression and comprehension, cognition, swallowing, and again, so much more. These therapies can be delivered as an individual or single discipline or in a multidisciplinary care team setting, which may be as an outpatient or in an inpatient hospital rehabilitation setting. Moving on to talk about rehabilitation in Parkinson's being underutilized and underrecognized. So there are clinical practice guidelines that recommend rehabilitation therapies, but their overall utilization is quite low, strikingly recognizing how important and beneficial it can be for people with Parkinson's. In addition, the provision of care of rehabilitation therapies is incredibly variable throughout the settings, disciplines, how it's delivered across the country as well as globally. In the US and in other countries, referrals and utilization rates are generally low, and there's data to support this low uptake. One study from looking at Medicare data, looking at 174,000 Medicare beneficiaries in the United States, found that only about 14% of people with Parkinson's have claims for physical therapy or occupational therapy or speech-language pathology. A recent international study that encompassed 4 countries and over 5,000 participants found that only about a third of people with Parkinson's were referred to rehabilitation services. And most commonly, this occurred when people were in the later stages of disease or in reaction to an event like a fall or advanced milestones. And most commonly, that referral was to physical therapy as a single discipline. Moving along to talk about disparities in Parkinson's and rehabilitation, data from the Medicare study that I just mentioned supports that there are differences across races and ethnicities. Here you can see that African Americans and Hispanic patients with Parkinson's were much less likely to receive rehabilitation therapies compared to Caucasian or white patients. In other studies that have been mentioned by other speakers, African American or Black people with Parkinson's were less likely to receive certain medication treatments, deep brain stimulation therapy, and in some to see a neurologist. So the research objectives for this grant were to overall examine the utilization of rehabilitation services in the Chicagoland area, focusing specifically on the Black and African American community and the South Side area of Chicago. We wanted to establish key stakeholders and community partners and identify barriers and facilitators regarding utilization of rehabilitation services. So in order to achieve this, our methods were as follows. We have applied a mixed methods approach to our research, which includes both qualitative and quantitative data. These are the steps that we took to start to understand and start to scratch the surface of a very important and complex topic. We first developed an advisory panel, which included a variety of different stakeholders, including people living with Parkinson's, care partners, healthcare professionals, and community advocates reflecting aging, recreation, or faith communities in the African American community. We then performed a comprehensive needs assessment to understand the landscape, some of the challenges and opportunities, and help design the focus group questions and identify participants. We then conducted several focus groups with people with Parkinson's, care partners, and healthcare professionals in individual settings. We used this information from the focus groups and advisory panel to help guide the design and development of the online survey that examined perceptions, attitudes, and experiences regarding rehabilitation care for Parkinson's. We recruited participants through email, social media, Parkinson's associations, our advisory panel, and networks within Southside Chicago and nationally. In terms of our group discussions, we held 4 focus groups, 2 with people with Parkinson's and care partners, and 2 with healthcare professionals. The focus groups were semi-structured in nature and facilitated by my wonderful colleague, Treasurer Williams-Wood, who's a speech-language pathologist. We developed a manual to cover some of these topics and themes, as you can see listed below. And from these topics, a number of elements emerged related to relationships among people living with Parkinson's and their provider team, the impact of race and ethnicity on care, and the need for culturally sensitive materials and education and awareness, looking at challenges with access to care, considerations of race and background in terms of care delivery, and supportive team care. So moving along, I'd like to share a little bit of the survey data. There's a lot of data within this whole project, so I'm just touching the surface for many elements here. So of the online survey, 355 participants completed the survey, including about 83% people with Parkinson's and 17% who were care partners. The majority were older, over 60 years, and more often, as often the case, care partners were female. We had about 10% who were identified as non-white and 90% or 89% who identified as white, illustrating some of those challenges in recruiting minority populations. Regarding disease duration, the more than half had greater than 4 years of disease duration. So turning to some of the results, we identified about 75% of people receiving rehabilitation care and reviewing that as helpful. A large percentage may relate to the study coming from a rehabilitation hospital. But some interesting points I would make. Only about 23% of Parkinson's patients and 28% of care partners reported being asked about rehabilitation services by their healthcare provider. Interest was greatest for physical therapy among those who had never received rehabilitation care. Moving on to the next slide, looking at underrepresented groups. And again, this is just a little bit of information we've so far gleaned. Non-white respondents did not differ statistically from white respondents in terms of their interest in type of rehabilitation care, but we looked at people's knowledge before their diagnosis of Parkinson's and after they've been diagnosed, how they viewed their perception of knowledge for rehabilitation care. And we did find a difference here in non-white respondents, feeling less knowledgeable before their Parkinson's diagnosis compared to whites. So our next, just to conclude with a few findings, that there's interest in rehabilitation care that's apparent in both people with Parkinson's and care partners, but predominantly still for physical therapy compared to other services. There's a need for increased dialogue for building relationships, trust, respect, and rapport, as well as community support and programs for rehabilitation and Parkinson's care, and that this should incorporate people's backgrounds and cultures. More information is still needed to better understand the experiences of underrepresented groups, including heterogeneity within these groups. So there are a number of opportunities for future directions, including continuing to work to increase participation and have greater discussion about rehabilitation care options by healthcare providers. It's important, one thing we found was to improve the ease of access to care and community support, and to continue on our mission to enhance awareness for culturally sensitive and team-based care. And in conclusion, I'd just like to thank the APDA again, our colleagues, and to all the participants in research.